empowered ladies. Welcome back to Mari.Trilogy. Today's episode is going to be on discussing the GLP-1 craze. And with us today is Jenny Huynh, a nurse practitioner. And we have a set of questions for her on the craze going around with these treatments. Welcome, Jenny.
Thank you. Thank you for having me.
So let's get right to it and let's dig into these questions. And there's a conversation, so just be open on whatever it is that you want to discuss with us. So let's start by understanding the basics. Can you explain what GLP medications are and how they actually work in the body to support weight loss?
Yeah, sure. GLP is actually a natural hormone that your body makes after you eat, which helps you feel full, and it works in a couple different areas in the body. So it works in the pancreas, tells your pancreas to produce insulin directly in response to glucose. So it's gonna reduce overall regular free insulin. It's gonna help reduce glucose production. So less insulin, less glucose, less insulin. It'll work in the gut to help you feel full. It overall reduces, slows down the emptying of your gut. So that's why patients get that like satiated feeling. They feel full. Constipation can happen. So that, which we could talk about it later, but that's because of that. Tells your brain, talks to your brain, says, I'm not really that hungry. You don't need to eat that cookie or whatever. Reduces fat deposit and it speeds up your metabolism. So with all those kind of things together, it's gonna help with weight loss.
With weight loss, yeah. Okay. Now, is there a specific medical criteria on who is an appropriate candidate for GLP-1 injections, and what factors would make somebody unsuitable for these treatments?
Sure. It's not intended for, we're talking about it in the weight loss sense, but remember, this medication came out to treat type 2 diabetes. So that needs to be mentioned too. It's not suitable for type 1 diabetics. For weight loss purposes, you have to have a body mass index, so your weight to height ratio. Obesity is going to be 30 and above. Overweight is 25 and above. So if you're underweight, this is not for you. This is not a good medication for you. If you have a history of pancreatitis, if you have a history of bowel obstructions, if you or somebody in your family, first degree relative, mom, dad, sibling, have a history of medullary thyroid cancer, this is contraindicated for you. So you should definitely speak to your provider. If you're considering doing this, make sure you get all that stuff.
Okay, so you're not a diabetic, a type 2 diabetic, and your body mass is over 25, then you are suitable to get.
You might be suitable.
You might. Okay. Let's talk about safety and side effects. What are the most common short-term and long-term side effects patients should be aware of?
So the most common side effect listed and actually reported is constipation. If some people don't feel anything, but you have to know that pouring in. If you're a constipated person, plan for it, because if you're on the medication, you might notice it's a little bit worse. If you're not normally constipated, you might notice a change in your bowels. That, again, doesn't happen every day. Some people get diarrhea. Nausea is a side effect that can happen, especially early on in the injection. So it's a once-a-week shot. So those effects might be more noticeable on the first few days after you put on the injection. And then it goes, meaning on.
Any serious side effects?
Yeah.
On the medication?
You can develop acute pancreatitis. And you'd have to stop the medication and seek emergency care. So that's going to be an inflammation of your pancreas. Some people, they get gallbladder issues. Some people can have other adverse effects that are rare, but if you notice something that doesn't feel right after being on the medication, you gotta talk to your healthcare provider. Yeah.
Okay. What about monitoring? Once you go on the medication, um, what type of monitoring do patients need while being on GLP-1 treatments? Like, what do you do? Routine labs, checks, checkups, adjustments over time? Is there a need for more medication or less medication depending on the amount of weight that you are using?
Yeah, so if you're on this for weight loss, I personally suggest everybody has at least a once a month follow up, check in for weigh in to see how you're doing, to go over your goals. Labs, I recommend at least every 3 to 4 months getting some routine blood work done, specifically to monitor like your sodium, potassium, kidney function, and that kind of stuff.
Okay.
Um, and for if you're diabetic, you should be monitoring every 3 months anyway. But for dose adjustments specifically for weight loss, is what we're honing in on here. Once a month is the appropriate checking. You come in and talk to your provider, how it's going, how I feel. Do I think that I need more, higher dose? Am I ready for it? Depends. How are you feeling? How are you handling the side effects? Do you have side effects? How is your weight loss journey going? Are you losing enough? Are you not losing enough?
Okay. So when you start the medication, do you start on, and I don't know about it. That's why we're doing this. But do you get one shot a week, one shot a day, one shot a month? I mean, do you increase it to how many? How does that work?
So the GLP-1s that are the long-acting ones like Ozempic, Wegovy, Manjaro, and Zepbound, or for some people, semaglutide and tirzepatide, those are once a week. Once a week shots. Dosing is dependent on how you're doing. You should be on the same dose for a month, and then the next month you might change your dose. And some people are doing alternate dosing, and they might do 2 weeks one dose, 2 weeks another dose. But you gotta give it. You should always start the lowest dose and then titrate up. Okay, because that will help reduce the overall serious side effects of the medication, as opposed to starting on a higher dose because you just want to try to get there faster. Jump board, you're gonna feel terrible.
Doesn't work like that. And any specific injection sites that you must use, or you can do ours?
Subcutaneous tissue, obviously this little part of us always has a little extra.
Right.
If some people like to use the back of the arm, some people like to use the thigh. I say whatever feels comfortable and easier for you to inject because it's a self-dose medication.
Okay. And is there a specific time frame you can be on this medication, or can you be on it for, let's say, 6 months and then cut it off and then come back to it?
So for weight loss purposes, absolutely. Yeah, you can be on it intermittently. I mean, I've had patients, I have a wedding to wear to. I just want to lose 10 little pounds, and then they get to their goal and then they're done. If you're diabetic, you might be on this for life. You might not. You might come off of it later. So it depends. But I hope that answers your question. Yes, you can be on it and come off of it, and you can stay on it. For weight loss, I don't recommend you stay on it for long term.
Okay. If someone stops the injections, how likely is that they will regain the weight?
It depends. So if they're on the injections for weight loss and they establish a strong, firm foundation of diet and exercise, and they stick to it once they're done with the actual medication, they can absolutely maintain the weight off. If they're not doing a strict diet and exercise regimen, and the medication comes off and they go back to
Their
regular old eating habits and sedentary lifestyle, they're gonna gain it back, and in some cases a lot faster than it took them to lose it.
Oh, wow.
Because why is it that? Because you get hungry again. You're like, so
over here.
you're not more hungry. And I've had people say like, oh, I came off the medication, I was hungry. No, you just weren't that hungry for a little while, and now you're hungry again. You forgot. You know, so if you have a good, strong foundation, if you're that picky person that's like, all right, I'm really gonna go into this and I'm gonna eat healthy and I'm gonna exercise. Once the medicine comes off, sure, you might feel a little hungry again, but you already know what you're supposed to eat and when you're not supposed to eat. And you go to the gym or you go outside for a walk or you do something and then it helps maintain the progress that you did. You don't want to lose it.
Of course. Of course. Um, how do you weigh the benefits of GLP-1 against potential risks, especially for long-term care use?
It depends on the patient. It should be a very patient specific therapy. So if they don't have any absolute contraindications, the benefits definitely outweigh the risks. You know, there's a lot of benefits with these medications. For diabetics, we've seen A1Cs that we haven't seen in years. I mean, people who couldn't get their sugar well controlled, and all of a sudden I'm seeing, yeah, my sugar's fine, and my A1C is down to 6. And great, that's awesome, you know? So, and for some people who have been like hypertensive, have been on this for weight loss, all of a sudden, guess what? My blood pressure is better. So the benefits, in my opinion, really outweigh the risks as long as you're the right candidate. Yeah, as long as it's for you.
Okay.
Yeah.
Well, there's a lot of craze with this. Do you believe people are relying too heavily on injections and overlooking the importance of exercise and healthy eating?
That's a hot topic.
Yeah.
I don't even know if it's 50-50 or 60-40, to be honest. There's two types of people. The people who are doing the diet and the exercise and are really motivated to lose the weight. And then there's the people who are like, yeah, no, I'm just gonna let the medicine do all the work. And they're not gonna see the benefit. They're not gonna see the full potential benefit of the medication. I tell my patients it's like putting gas in your car. You can fill up the car with gas. It's not gonna drive anywhere. You gotta get in the car, you gotta drive it.
Right.
So this is the gas. This is gonna help you get there. This is gonna help you see results a lot faster, get you over that plateau where you kind of get stuck on your way. But as long as you exercise, if you don't, you might see a little bit of weight loss. You might see, I mean, there's some people who are like, oh yeah, I lost, 30 pounds. You might have lost 60. You know, you don't know because you didn't do the right thing. So yeah, there's a little bit of both. The right way to do it, yeah.
Focusing on losing the weight and staying healthy, not just
The
losing
other-
30 pounds and that's it.
Correct.
Right?
Correct.
So looking ahead with the current craze, what do you see as the future of GLP-1 in not only weight management but diabetes control? Do you believe they are here to stay, or is this more of a trend?
They're here to stay. There's more to come. These are not new. They're new to us. They're new to, not to me, but to, I think, the consumer, the general public. All of a sudden, they know about this because it was a new FDA indication for weight loss. These medications came out years ago for diabetes in a short-term form, short acting. And then we started seeing, oh, patients are losing weight on this. So they didn't just get here. They've been here. Now we're seeing the potential benefits of the medication. There's actually a lot of studies now going on with these specific medication, the long-acting ones, to see if there's benefits for Parkinson's, Alzheimer's, dementia, PCOS. PCOS.
Wow.
We know it helps with sleep apnea. It already has an indication for coronary artery disease and overall risk reduction in cardiac deaths. So they're not going to leave. They're going to be here. And I wouldn't be surprised if, like, in another 10 years, all of a sudden we have a new indication, new indication, and more insurance coverage. So that's the way it is with all these.
Is there still an issue with coverage by the insurance companies, or always?
Always, I mean, it's insurance companies. So if you have the right indication or right documentation, and it depends on your insurance formulary plan, a lot more people have it covered in the last 2 years I've seen, and in the last 5-6 years.
Okay. Yeah, I was reading an article not too long ago about the benefits for dementia patients.
It's coming out. The studies are still like they're still
That's a preliminary thing.
preliminary, but they're promising. Yeah. So that's anything that can help in all those parts of medicine where we still don't know enough and we don't have a lot of tools in our pantry to help us with these patients, I think is awesome.
Oh, yeah.
Yes.
So thank you. That was really interesting. To finish our podcast today, as part of your practice, I know you offer prescriptions for GLP-1 treatment, correct? What else does your practice offer to all of our viewers that might be valuable for them to know?
Thank you. I offer prescriptions for patients that qualify and need these medications, and we do follow-ups for that. But the primary focus of my practice is aesthetics. So it actually helps with a lot of these patients because they have, sometimes from the weight loss, they get the new Ozempic face that's being thrown around where you get like the thinning with the face and the loss of the fat under the eyes, the cheeks, and the volume loss. So with that, we use neurotoxin injections and dermal fillers to help give you back a plump, right, and tightening.
Yeah, you keep hearing, oh, she has the Ozempic face, and I didn't know what that
I
was.
like that term. It's like it sounded very nice, but it doesn't sound very nice. So I'm like every time I hear it, I'm like, oof. But that's what it needs when they have like the loss of the fat where you want it. You want the fat. You don't want to have these huge bags of your eyes or the sunken look. Right? You don't want to lose your nice cheekbones and all that stuff that we have. So.
Well, thank you. That's great to know. Well, there you hear, ladies. We have somewhere to go to get beautiful. Thank you for being here today and for your time. Stay tuned for our next Empower Her event coming up in October. And our next Mari.Trilogy Podcast, we will be focusing on mental health with a licensed clinical social worker. Thank you for being with us today.